So remission doesn't always mean resolution. Most of these people weren't in true remission. They were on anti-thyroid medication, usually methimazole, for a year and a half, and then their thyroid hormones and TSH looked good, so they were taken off the medication, but the immune system was ignored. So the endocrinologist didn't recommend anything for the person's immune system health, which is why most people eventually relapse. I would say pretty much 100% of the time, the endocrinologists aren't doing anything to address the cause of the problem. All right, so once again, this episode is inspired by a message that I received on Instagram. This person is doing something what I call the functional overlap, where you're using meds, but also layering in herbal support, either things like bugleweed or thyroid calming formula. And the one thing I will say, these combo formulas, some of them could be really good, but bugleweed is the main herb that helps with the symptoms of hyperthyroidism. And then also mention, is there any correlation with hyperthyroidism and high cholesterol? And it's another great question, because I'll go ahead and read the comments and then respond. So it starts off by saying, I have Graves, and I just listened to you on the Root Cause podcast or someone else's podcast. It was so informative and helpful. There is so much out there about hypothyroidism and Hashimoto's, but hardly I ever find any podcast or information on Graves and hyperthyroidism. So it was awesome to gain some information. I'm diving deep now with a functional doctor on trying to stay off the methimazole and avoiding getting the person's thyroid taken out. I managed before to be off the meds for over 1 year, and then it came back with a vengeance after I had my baby. So back on low dose methimazole now, started taking thyroid calm, and it seems to help. I take it daily and skip some days with my meds. Eventually would like to be off for good. Also now working with a functional doctor on trying to see if there is any correlation with hyperthyroidism and high cholesterol. It's always a deep dive. So let's start off by talking about Graves versus Hashimoto's visibility. Because if you've been searching for answers about Graves' disease or other types of hyperthyroid conditions, you probably have noticed that there's no shortage of podcasts, books, articles on Hashimoto's. But when it comes to Graves' disease, there's not a lot of information out there, which is one of the big reasons why this podcast has a little bit more of a focus on hyperthyroidism and Graves' disease. Again, a lot of the content also will benefit those with Hashimoto's, but I don't have a whole lot of episodes that are dedicated to Hashimoto's, but I do have a good amount of episodes dedicated to hyperthyroidism and Graves' disease, just because out of all of the thyroid-related podcasts out there, none of them, at least none that I have found, have really any episodes that focus on hyperthyroidism and Graves' disease, with the exception of those that have interviewed me. So that when I'm on another podcast, talk about hyperthyroidism and Graves' disease. But other than that, typically they're focusing mainly on hypothyroidism, Hashimoto's. So why is that the case? And the obvious reason is because Hashimoto's is a lot more common than Graves' disease. A lot more people have Hashimoto's than Graves' disease. In fact, I'm pretty sure that Hashimoto's thyroiditis is the most common autoimmune condition, not just the most common autoimmune thyroid condition, but the most common autoimmune condition. But when it comes to Hashimoto's versus Graves, approximately 8 times as many people are diagnosed with Hashimoto's as with Graves. And I'm sure there are a lot more people that are undiagnosed with Hashimoto's. Like Hashimoto's, not that Graves, you could get undiagnosed with Graves for a while, but it's more common also with Hashimoto's. So that's one reason. Second is because most functional medicine practitioners have more experience with Hashimoto's. And that brings us back to the first point, is that because there's a lot more people with Hashimoto's. But then even when I interview practitioners, I mean, it's not uncommon for me to interview a practitioner who has a story, their own Hashimoto's health journey. I've had a few with their own Graves' disease journey, but even when the focus isn't on thyroid health, when I'm talking about someone who's talking about perimenopause or some other health condition, it's quite common for them to say, hey, by the way, I had Hashimoto's. So where again, you don't get, it's not as common with Graves' disease. So those are really the 2 main reasons I would say that you see a lot more information related to hypothyroidism and Hashimoto's, why Hashimoto's content dominates. And so again, my goal has been to not just with the podcast, but just with everything I do to focus more on hyperthyroidism Graves' disease. Even with the books, I've written 2 books that focus on hyperthyroidism, natural treatment solutions for hyperthyroidism and Graves' disease, as well as the hyperthyroid healing diet. I do have a book, Hashimoto's Triggers, and that probably will be the only book that I write that's dedicated to Hashimoto's. I might come out with books that focus on both, and I'm pretty sure I'll come out with others that just focus on hyperthyroidism. And again, I have other pieces of content like articles, and I have a Facebook group. Again, I have a Facebook group that's dedicated to both Graves' and Hashimoto's, but then I have also a much larger Facebook group that just focuses on hyperthyroidism. And so let's go ahead and get back to the message. So again, that was one point that the person brought up in Instagram message I wanted to bring up. But then also the person said that they managed to be off of the medication, and then he came back with a vengeance, started taking thyroid calm and skipped some medication. So definitely want to we'll talk more about this. Let's move on to, well, why don't I talk a little bit about relapse? Again, I want to cover a few of these points brought up in this Instagram comment or post, whatever you want to call it. But remission, so many, let me go back and let's see. So this person said, I've managed before to be off the meds for over a year and then came back with a vengeance. So many endocrinologists would have said that this person's in remission, but the problem is that most of the time they're not doing anything to address the cause of the problem. I would say pretty much 100% of the time, the endocrinologists aren't doing anything to address the cause of the problem. Now, maybe if the person's seeing an integrative endocrinologist where there aren't a lot of integrative endocrinologists. I did have one on the podcast. Actually, I've had a couple. I've had Dr. Angela Mazza, who's in Central Florida, Dr. Brittany Henderson, who is in Charleston, South Carolina. And but again, there's not a lot of integrative endocrinologists. But most of these people weren't in true remission. Most of these people, they were on antithyroid medication, usually methimazole, for a year and a half, 2 years, and then their thyroid hormones and TSH looked good. And so they were taken off the medication, but the immune system was ignored. So the endocrinologist didn't recommend anything for the person's immune system health, which is why most people eventually relapse, is because all they do is take the medication. Maybe they make some changes to their diet on their own, again, not through the endocrinologist. But yeah, so remission doesn't always mean resolution. Usually it doesn't mean resolution because it's not true remission. Stress is a big trigger. Now, this person also mentioned that it came back with a vengeance after I had my baby. So that also brings up postpartum thyroiditis, which postpartum thyroiditis is actually Hashimoto's. It's not Graves'. So like what postpartum thyroiditis, people have the antibodies for Hashimoto's. And during pregnancy, a lot of people, when they have Hashimoto's, it actually, the immune system modulates, the pregnancy modulates the immune system where it's no longer attacking the thyroid. But then when the person gives birth, then they get that flare up postpartum thyroiditis, which many times presents as hyperthyroidism. So in this case, it's possible, even though this person has a history of Graves' disease, it's also possible that if this was postpartum thyroiditis, it's actually, again, Hashimoto's. But sometimes what happens is it doesn't happen right after the birth process. It happens months after. So in that case, not to say it can't be postpartum thyroiditis, but perhaps in this case, maybe it was the Graves' relapsing. Again, we don't have enough information since it was just a comment on Instagram. But being a mom is very stressful. I mean, just sleepless nights, or at least maybe a few hours sleep. And again, everybody's different. Some get more sleep than others. Some might get 5-6 hours sleep, but others are not getting much sleep. And just other stressors, of course, in life could be a factor. So yeah, stress management, just becoming an expert in handling stress is important, because that's one of the biggest reasons why people relapse. I mean, the biggest reason is because, again, they weren't in remission in the first place. They never did anything to address the immune system component. But even people who do improve their diet and lifestyle and do testing to find their triggers, again, for those people who do relapse, stress is a big factor. And just a reminder, I was diagnosed with Graves in 2008. I've been in remission since 2009. Thankfully, I haven't relapsed, and I've had my share of stressors. I've had a good amount of stressors. So everybody's different. And even though I've had a good amount of stressors, I've also greatly improved my stress handling over the years. Although we also need to consider other stressors, not just emotional stressors, but overtraining or dealing with certain infections. So there are numerous reasons why someone might relapse. And yeah, so anyway, just wanted to bring that up. And I could understand that it could be incredibly frustrating when someone does relapse, especially if they feel like they're doing everything right and they're in a good place. And then they feel like, okay, I'm back where they started. And again, if all you did was take the medication and it didn't do anything to improve your health, the good news is there's a lot you can do to improve your health. Now, for someone who has done a lot to improve their health and then they relapse, that could get more frustrating. But all you could do is get back on track. I keep on saying, I mean, of course, I hope I continue to remain in remission. But if I were to relapse tomorrow, yes, I'm sure I would be bummed out, but I would go back to what I did years ago. I mean, maybe not exactly the same thing, but I would take at least a similar approach. I wouldn't have any regrets that I followed a natural treatment approach years ago and that I didn't receive radioactive iodine or thyroid surgery. So yeah, just wanted to bring that up. And then let's talk about this person also mentioned thyroid calm. Let's get back to here. So back on low dose methimazole right now, started taking thyroid calm, seems to help. I take it daily, skip some days with my meds. And obviously that's up to the person. I'm not going to say anything about skipping medication. Now, when I dealt with Graves' disease, I didn't take medication at all. So there was no medication to skip. But this person is doing something what I call the functional overlap, where you're using meds, but also layering in herbal support, either things like bugleweed or thyroid calming formula. There's a few different formulas that have bugleweed, motherwort, lemon balm combined. And so this is what this person is doing. And the one thing I will say, I mean, these combo formulas, some of them could be really good, but bugleweed is the main herb that helps with the symptoms of hyperthyroidism. And so when someone is trying to rely more on the herbs than a medication, and again, I'm not telling anybody to do this. Again, if someone's taking medication, that's up to them whether or not to continue taking it or to stop taking it. But if someone's taking the medication and they want to try to rely more on the herbs, you might want to consider taking bugleweed separately and not like a thyroid calming formula. Like if a patient's working with me, if someone starts working with me and they're taking thyroid calming formula, and if it seems like it's helping, I'm not going to tell them to stop. But if they're not taking anything, I'm not going to tell them to start with like a combo. Like when I dealt with Graves, I took bugleweed separately, I took motherwort separately. I did not take lemon balm. But if someone wants to take lemon balm, I usually would recommend to take that separately. Again, if someone's taking thyroid calming formula or there are other variations, other brands that have these combo formulas. Again, if it seems like it's helping, I'm fine. Or if they already purchased it and they want to give it a try, that's fine. But the problem with these formulations is that they don't have a lot of bugleweed because they need room for the bugleweed, the motherwort, and the lemon balm. And lemon balm might have some mild antithyroid properties, but definitely not as potent as bugleweed. If you are looking to do everything you can to save your thyroid, in addition to watching my videos on YouTube, you also might want to subscribe to my free online newsletter, which is called Healthy Gut, Healthy Thyroid. Not only will you get the latest news on how to heal your gut and restore your thyroid health, but during each edition, I'll demonstrate a different blood or functional medicine test marker that relates to healing your gut and or your thyroid. There will also be an Ask Dr. Eric section where not only can you see questions that other people have asked related to gut and thyroid health, but you can also submit a question for me to answer in a future edition. To subscribe to the Healthy Gut, Healthy Thyroid newsletter, please visit savemythyroid.com/newsletter. And then, I mean, getting back to the person skipping medication. So again, obviously people could do what they want. I have no control over this, but even with my patients, my patients will skip it. Just keep in mind, you want to be safe while addressing the cost of the problem. So I can't say I'm a big fan of people skipping the meds. I would say I could understand if someone just decides not to take it altogether. And what I mean by that, again, not saying to stop it, but if someone is like in my situation where they didn't start it to begin with and they want to just take the herbs, but if someone's already taking the medication, and if it's not, I mean, again, if it's causing side effects, I could understand. Obviously, you could go back to the prescribing doctor, but just again, you want to be careful. You want to be safe if you do choose to take the medication. And that's all I'll say there. Again, I know I'd sound like a hypocrite if I said don't take the medication because, again, I didn't take the medication. So, and I work with people who don't take the medication, again, on their own. And then also people who do take the medication. So I'm pretty open minded. But if someone, kind of like antibiotics, it's like you either take the antibiotics or you don't take the antibiotics. You don't take the antibiotics like every other day or like once a day instead of twice a day. So I think it's similar with this. If you're either going to take the meds or you're not going to take the meds. And so I would say don't like skip around and miss doses and all that. And yeah, so now if someone's going to take the meds and they're going to take something like bugleweed, which again, I can't say all my patients do this, but I do have some patients who will take both because they want to try to get off the medication sooner than later, and they'll add the bugleweed. Again, I'm not telling them to get off the medication sooner or later. The way you know you need less of the methimazole, let's say you're taking bugleweed, methimazole, and then you're going to do a follow-up thyroid panel eventually. And then as that becomes more hypo, then you will ask the prescribing doctor to reduce the dose of the antithyroid medication, whether it's methimazole or PTU or carbimazole. And I also recommend to take them apart, like don't take them right next to each other. So if you maybe like 30 to 45 minutes apart, I mean, you can take them further apart. And this is just the approach I take. There's nothing in the research that talks about taking methimazole and bugleweed at the same time. So I don't know of any interactions. There's nothing in the literature. If you ask, you could ask a pharmacist, but there's nothing I've seen or heard. And I've had people do it for many years. But again, I usually have them space it out and not take it like right after the other. So just wanted to bring that up. And then again, in this case, this person's on a small dose, which is great. But regardless, even if someone relapsed and if you need to be on the medication, I wouldn't look at it as a failure. I mean, again, there's a time and place for the medication, or if someone's taking the herbs and it's not effective. If someone's taking natural agents to try to manage the symptoms and it's just not helping and they need to be on the medication, again, I would not look at this as being a failure because, again, there's a time and place for the medication. And as long as you're trying to do things to address the cause of the problem while taking the medication, then that's what's important. I mean, even when I took bugleweed and motherwort, those weren't addressing the cause of the problem. Those are just naturally managing the symptoms. And if that's all I did, I wouldn't have restored my health. All right. So I think those are some of the main points I wanted to mention here. I mean, it's great. This person is also working with a functional medicine doctor. And then also mention, is there any correlation with hyperthyroidism and high cholesterol? And so, and it's another great question because high cholesterol is actually more common with hypothyroidism. I have some articles, and I'm pretty sure I have a podcast episode where I talk about cholesterol and the thyroid. And again, when someone is hypo, it's more likely to cause high cholesterol. So if someone's taking antithyroid medication that's blocking thyroid hormone production, that might cause high cholesterol. And it's a shame, just because, very sad, because a lot of people who have high cholesterol are given a statin and really the thyroid might not be looked at. So obviously I'm not talking about necessarily people who are listening to this, but just in general, like you might know someone who has high cholesterol and they're on a statin, and you might want to ask, well, did you ever get your thyroid checked just to make sure that you don't have a thyroid issue? But high cholesterol, not as common in Graves. Actually, if someone has unmanaged hyperthyroidism, usually we'll see cholesterol on the lower side. And sometimes it'll get, not, I wouldn't say crazy low, but I usually like to see cholesterol above 150. Like I don't want to see it, we don't want to see cholesterol crazy high, but we also don't want to see crazy low. If someone has a cholesterol of 80, that's too low. Cholesterol is important it's important for forming the sex hormones and cortisol. I mean, so you don't want, and it has other important functions. So you don't want cholesterol to be too low. But if someone has hyperthyroidism, and again, they're not taking the medication, so they are, let's say, or maybe they are taking the medication, but they're still hyper, and yet their cholesterol is high, then there could be other factors. So, I mean, just a lot of inflammation could actually cause cholesterol to increase. I mean, sometimes eating a lot of saturated fat. So, like we see this if someone is following a carnivore type diet, which so they're eating a lot of animal protein. And again, everybody's different. There are some people that could get away with eating animal protein and the cholesterol and LDL will look fine. But then there are people where they're eating a lot of animal protein and the total cholesterol and LDL will look very high. And so that could also be a factor. I mean, there's some genetics as well that's involved for some people too. So, I mean, I wouldn't just rely on the lipid panel. You might want to look at some other markers like LDL particle, for example. And I mean, I'll try to remember. I actually have, I mean, I might have brought it up in the podcast interview, but I also have on my website, naturalendocrinesolutions.com, I have some articles related to cholesterol and looking at some like advanced lipid markers as well. So yeah, those are things that you might want to consider if your cholesterol is high. And then finally, this person also said something that stuck with me. It's always a deep dive. And honestly, honestly, that's true. So it's for most people that it's complex. I mean, Graves' disease, other autoimmune conditions, even non-autoimmune hyperthyroid conditions, it can be challenging. It can be complex. And healing isn't always linear. So that's the thing too. Like with people with Graves' disease, it'll get discouraging because like I want to see the antibodies for both Graves and Hashimoto's decrease and eventually normalize. But sometimes it's like a roller coaster ride where it will you'll take two steps forward and one step back. When you see that one step back, so if the antibodies increase, if they decrease but then they increase, it gets discouraging, which I understand. But I mean, if we see it consistently increasing, that's not good. But if we see kind of a roller coaster pattern, but over time it's getting lower, that's great. That's great. I mean, obviously, if someone's gradually improving, their antibodies are gradually decreasing with no setbacks, that's even better. But a roller coaster effect is quite common. Setbacks are common. And that's why I talk about setbacks and I talk about roadblocks. Again, progress is not always linear. And again, you should, when working with someone, so this person's work with a functional medicine practitioner, which is great. Again, work with someone who welcomes complexity. And again, I mean, don't get me wrong. I definitely enjoy working with people who progress gradually without any setbacks or roadblocks. But again, I've just come to realize after working with people with hyperthyroidism and Graves' disease for over 15 years that more times than not, there's going to be setbacks. There's going to be roadblocks. I mean, that's why another reason why you want to work with someone who is experienced, because if someone is just a newbie in practice, I mean, they got to learn somehow, but again, they might not be used to the setbacks and the roadblocks. So yeah, it's great that this person is working with someone, and hopefully the person who posted on Instagram will do things to improve the immune. This person's, oh, I mean, the person's taking thyroid calming, which is great, but again, that's not improving the immune system health. But to me, that just also shows that this person has a natural mindset, not just relying on the medication. And yeah, so whether you're dealing with Graves' disease or a non-autoimmune hyperthyroid condition, whether you're on methimazole or taking bugleweed or a thyroid calming formula. I mean, again, this is a process that asks for patience. You want to receive the right support, and again, that's of course the purpose behind this podcast. And again, I have other resources as well. So besides the podcast, again, my books, the two books on hyperthyroidism. And then also I have a webinar. So if you haven't checked out my free webinar, you might want to do that as well, as I talk about the framework I use to help people with Graves' disease and hyperthyroidism move towards long-term stability. If you haven't watched it, it's called the 5 Steps to Reverse Hyperthyroidism and Graves' disease. And I talk about how to avoid radioactive iodine and of course, support your thyroid and immune system naturally. The 4 main categories of Graves' disease triggers, including some hidden ones that often get missed, how to break the hyperthyroid cycle. And this is true, especially if you've relapsed after a period of remission, like this person who posted on Instagram did. How to work with more complex situations like thyroid eye disease or those with toxic multinodular goiter. So it's not just about Graves' disease. And again, this isn't about quick fixes, but it will help you to feel more grounded in what's possible, what to focus on first. So again, if you haven't checked out that webinar, you might want to do so. You could sign up at savemythyroid.com/hyper webinar. Again, savemythyroid.com/hyper webinar. I'll also include the link in the show notes. And thanks again for tuning in. And wherever you are in your healing journey, just keep looking beneath the surface. Sometimes that's where the clearest answers come from. And I guess I'll end it on that note. So again, thanks for tuning in. Hope you found this episode to be valuable. And of course, look forward to catching you in the next one.